In our last episode, I explained how the Affordable Care Act provides reduced cost sharing for eligible individuals who will buy health insurance coverage through a state exchange. This time, we're going to look at health insurance premium tax credits for small businesses. Now, these tax credits have actually been in effect since the 2010 tax year. Starting in 2014, only small businesses that purchase group coverage through the exchange will be able to take the credits. Now, to qualify for the credit, an employer must have no more than 25 full-time equivalent employees for the tax year, pay average annual wages no higher than a certain amount stated in the law, and pay 50% or more of the group health insurance premium for employees. To calculate the number of full-time equivalent employees, take the total number of hours of service for which the employer paid wages during the tax year, divide by 2,080, which is 52 weeks times 40, and round down to the nearest whole number. For example, if the employer determined that it paid for 40,000 hours of service during the year, you divide 40,000 by 2,080, arrive at 19.231, and round down to 19. So this employer had 19 FTEs. Now, if one or more employees work more than 2,080 hours during the year, their hours are capped at 2,080 for purposes of calculating the number of FTEs. Suppose 20 employees work 2,000 hours and 5 work 2,500 hours. If you use the actual hours worked, the total comes to more than 52,000, making the employer ineligible for the credit. However, because the 5 employees' hours are capped at 2,080 each, we use 2,000 hours times 20 employees, which totals 40,000, plus 2,080 hours times 5 employees, which totals 10,400. This gives the employer a total of 50,400 hours for the year. Divided by 2,080 and rounded down, this gives the employer 24 FTEs for the year, so the employer still qualifies for the credit. The average annual wages are the aggregate amount of wages the employer paid to employees during the tax year divided by the number of FTEs and rounded down to the next lowest multiple of $1,000. So, suppose the employer in the example above determined that it paid $1 million in wages for the year. $1 million divided by 24 FTEs gives us an average annual wage of $41,667, which we then round down to $41,000. This employer paid an average annual wage of $41,000. Now, when calculating the number of FTEs and the amount of average annual wages, do not include hours worked and wages earned by seasonal workers, unless they worked on more than 120 days for the employer during the year. However, the hours and wages of leased employees must be included. Now, the maximum amount of average annual wages which an employer can pay and still qualify for the credit is double an amount stated in the law. Now, for the years 2010 through 2013, that amount is $25,000, so average annual wages must be below $50,000. Starting in 2014, that amount will be adjusted annually to reflect changes in the cost of living. The employer in our example paid average annual wages of $41,000, which is less than $50,000, and therefore the employer qualifies for the tax credit. Now, the amount of the credit for for-profit employers is 35% of either the aggregate amount of premium contributions the employer made on behalf of employees for health insurance during the tax year, or the aggregate amount of premium contributions the employer would have made if each employee had enrolled in a plan through the exchange that had a premium equal to the average premium for the small group market in the employer's rating territory, and you take whichever number is lower. That credit percentage rises to 50% during the 2014 year. 501c not-for-profit employers are eligible for a credit of either 25% of either the amount I just described or the amount of its payroll taxes for the year, again, whichever is lower. That percentage rises to 35% starting in 2014. The more employees the employer has and the higher the average annual wage, the more the credit is reduced. To determine the amount of the reduction, take the number of FTEs in excess of 10 and divide by 15. Multiply this fraction by the amount of the credit. Second, take the amount of average annual wages in excess of the amount stated in the law, which for example is $25,000 this year, and divide by the dollar amount. Multiply this fraction by the amount of the credit. Add the two dollar amounts together, The result is subtracted from the amount of the credit to arrive at the final credit. To illustrate, imagine an employer with 17 FTEs and $35,000 in average annual wages in 2014. Also assume that the cost of living adjustment has raised the dollar amount stated in the law to $25,500, and suppose this employer's for-profit business paid $30,000 in contributions for the employee's health coverage. The initial credit amount is $15,000, which is 50% of $30,000. Now, since the employer has more than 10 employees and pays average annual wages of more than $25,500, we have to reduce the credit. The calculation looks like this. 17 FTEs minus 10 equals 7. Divide this by 15 and we get 0.47. Multiply that by our initial credit of $15,000 and we get $7,050. Next, $35,000 average annual wages minus $25,500 equals $9,500. Divide this by $25,500 and we get 0.37. Multiply this by our initial credit of $15,000 and we get $5,550. Add the $7,050 and the $5,550 together, that gives us $12,600. We subtract this from our initial credit of $15,000. The final health insurance premium tax credit for this employer is $2,400. The employer can take this credit for up to 2 consecutive years. That's all for this episode. I hope you will tune in for the next one. Thank you for watching. I'm Tim Dodge.